Member Saanich North and the Islands.
Thank you, Mr. Speaker. Over a year ago, I asked the Minister of Health for realistic timelines about when community members in my riding will start to seeing real solutions to the shortage of primary health care services on Saanich North and the Islands. His response, he mentioned that 1 in 6 British Columbians was without a family doctor. He also promised that a primary care network would be established in several areas in the province, including the Saanich Peninsula, within the year. In April of this year, I asked again the Minister of Health about the healthcare crisis in my riding and many other areas in the province. His response was that government was hiring hundreds of family practice doctors, nurse practitioners, and clinical pharmacists to ease the crisis. At the time, the minister was quite optimistic about getting new primary care networks established around the province, and in particular, specific areas of the province experiencing acute shortages. In my riding to date, the most substantial work has been done, relieving pressure has been done by nonprofit organizations. My question is to the Minister of Health. On the ground, my constituents are not seeing results. They're having difficulty accessing primary care services. What is the delay in changing the outcomes for people in the Saanich Peninsula and across Greater Victoria?
Minister of Health.
Thank you. Thank you. And of course, Honourable Speaker, I was very proud just to be joined by the Minister of Finance in announcing a new urgent and primary care centre in James Bay, which will have a real effect for people of the area. It's one of 11 in operation, 14 that we have announced that are making a real difference, particularly in communities around British Columbia. I want to note particularly the extraordinary work by doctors and nurse practitioners and nurses in Prince George who developed their primary care network working hand in hand with an urgent and primary care centre that's making a real difference for people. Here in the South Island, we're also taking steps. The member will know that on November the 22nd, which is just recently, the final proposal around the South Island Division of Family Practice proposal was submitted. We're taking specific steps and specific action. We're working with doctors and nurse practitioners and the community, not imposing, but working with them, and that will lead to lasting solutions. I'm very proud of the work of the South Island Division of Family Practice, very proud of the work of the Ministry of Health. We're making progress, and we hope to have announcements soon.
Saanich North and the Islands on a supplemental.
Thank you, Mr. Speaker. And I thank the Minister for his response earlier this summer. And the situation was dire. Early this summer, the Times columnist, doctors were saying that primary care in the Greater Victoria area was on the verge of collapse. I've met with a wide variety of healthcare practitioners in my riding to discuss the situation that's going on in their offices. Health professionals are exhausted, exasperated, and feeling underappreciated, Mr. Speaker. The system is overburdened, and practitioners are burning out. Mr. Speaker, since those questions last year, I've had a constant flow of communications from my constituents who are equally exhausted, exasperated, and feeling as ignored as those in the healthcare system that we rely on. Patient attachment to primary healthcare home is important. However, it is just a single metric. It's equally important that we not forget some of these most deeply intimate relationships with our healthcare professionals. We must focus on the quality of life of both patient and practitioner. Again, to the Minister of Health, how is the vision of his transformation of our primary healthcare system addressing not only patient attachment to practitioners, but also ensuring that they have a quality of life and a healthcare system that's meeting the needs in our community?
Minister of Health.
Thank you, Honourable Speaker. And yes, I think in particular, young doctors have a different view of the way their practices should go. Overwhelmingly, for example, in surveys we take of young doctors, there's a desire to move to alternate payment models than fee-for-service. But, Honourable Speaker, both are essential parts of our system. In the last year, for example, 338 new fee-for-service general practitioner doctors have been added in British Columbia. Over the past year, 129 alternate payment plan doctors have been added. Now, significant numbers, of course, are retiring as well, but that is 140 net new doctors in 2018-19. That doesn't mean that we're able to deal with all of the challenges out there, but what we're doing, adding urgent and primary care centres, and in this area of the province in particular, the most successful urgent primary care centre in Langford. We're adding primary care networks. I cite the ones in George, the ones in Penticton that are working and making extraordinary transformational change at a local level. The support for community health centres such as Island Sexual Health and many in the members' ridings, which have helped sustain and support and advance community health centres. This is a comprehensive plan, and we're doing it methodically, step by step, community by community, working with local divisions of family practice, so we're dealing with the problems, and the problems faced both by patients and doctors in the system. I think it's an effective response. We're doing it, as I say, in partnership with the divisions of family practice, and it's why I don't think there has ever been, overall, as good a relationship between the provincial government and doctors. I remind the member that 98.5% of doctors approved our latest negotiated agreement in British Columbia, which is an extraordinary success.